And the different thing about this for healthcare workers is normally when we use an N95 respirator, and you have to be fit tested for those because we have different sizes, so you have to get the correct seal for your face. Normally those N95s are used for airborne disease only, so we can reuse those masks until they lose their shape, their integrity, or that seal check no longer seals. And you'll see her do that here in a minute. She's checking her seal to be sure no air is coming out, and she's got a good seal around her face. She's also going to put some eyewear on. We've chosen to go with the face shield. Goggles and glasses will actually expose the skin at the cheek area. So we have chosen to go with this mask. And when she puts her suit on, it will actually enclose everything. There's some little drawstrings on her suit. That's just going to have extra security so that sleeve is not moving up and down. She's going to put on that hood. And of course you would get something more closer to your size, because you wouldn't want all that excess and possible contamination when you're going in the room. So we would definitely get her a smaller suit. Now it looks like she's completely sealed, but when she turns her head from side to side, you can see the ear and the cheek are still exposed. And her face shield is coming out. So we would want to make that a completely closed system. So we would kind of put some tape around the edges of her face, but not covering up her vision field nor her nose or mouth. Now she can breathe fine in this. People that are claustrophobic do have to talk themselves through it a little bit. We have a second option for them. And we close up this zipper seal. It actually closes from the inside, and then there's a flap that goes on the outside. And if we still question that this was secure, we could run some tape all the way down the side of that as well. Now she's putting on her third layer of gloves. So you can see how hard this would be to make sure you are not contaminating yourself during the removal. The third layer of gloves actually go over the top of the suit. And we're going to put some duct tape around that as well, or some Kim tape, just to be sure we have a nice closed system. So if someone were to get sick on her, nothing would run down her sleeve and into her gloves. As well as during the decontamination process, it will just run off of the suit and off of the glove. Now she's got a little pad there, you may see that. That's going to be there for her to easily remove, so she's not picking at the tape trying to remove it. So now she looks at her buddy, they have no open areas, everything's nice and sealed, so she's going to go in the room. This is where, we'll stop right there, Danielle. This is like an anterior room, a room that you are actually going to be in before you get to the patient room. There may be a sink there, it'll have your bio container, which will be something big. There'll be a basin there that she actually steps into with the biohazard bag. So this is where she will actually come outside the room and decontaminate. So she's walking from a clean area because she got dressed in a clean area with clean supplies. She's actually coming in through that anterior room. Now she's going to walk into the patient room. So this can get very hot and of course very expensive when you have to dress like this every time you go into a patient room. So you're going to make sure that you provide everything or anticipate everything that patient would need. You're going to provide nourishment. You're going to bring any toiletry items that they may need for the day. You're going to make sure that you have any bed linen or extra supplies, any medication, any IV fluids, anything that you could think they would maybe need at that time. You're going to group all those tasks together. So after she goes in and she finishes taking care of her patient, she's ready to come out. Her assistant is also dressed in full PPE. Not as elaborate as Danielle, but in that blue suit, I think I have one back there. It's more of a soft material, it's fluid resistant, but she is also covered from head to toe with eyewear, along with, she's double gloved, she has an N95 mask on, and this is the suit that Pam would have on. She would have something, a hooded bunny suit that actually zips up. So everything on Pam is actually contained as well. She'll have on her rubber boots. Now she's going to go through the decontamination process. She is spraying her down, and her arms would be out very wide with a Clorox and water solution, front and back, making sure we've gotten anything possible that has contaminated her off. Now again, she's stepping in some sort of a bin that has a red biohazard bag in it. She gives her a Clorox wipe because she's going to wipe off any excess fluid that may be on her hand from that decontamination process or anything we may have missed. Once she does that, she's then going to remove the tape around her face, down the side of her suit. And this is a very slow process because in the removal, we do not want to create any aerosols or droplets that we may breathe in or contaminate the rest of our suit. So again, she's removing all of her tape. She's going to remove that first layer of gloves, or the last layer of gloves. Again, very slow. This is nothing she has to remember. Her buddy will have a sheet that she's walking her through it. There is also one posted on the wall that she can visualize. Now her buddy with clean hands that is double gloved will pull that zipper away from her mask, slowly zipping it down. And we want slow movements, making sure there's nothing unnecessary that we have to do. She's going to fold back the suit from the inside out, starting with the hood. She's then going to turn around and continue that rolling process from the clean all the way down. She's actually going to step out of the warm zone into the cool zone, which is the clean zone. She's then going to remove her second layer of gloves. And again, we have that trash can already big and open, so we wouldn't even have to move that. She's going to slowly remove her eye protection. Careful not to let those elastic bands spring back on her to where she can get something in her eyes or on her mask. And this is the hard part, because we normally will grab that mask and take it off because it's an airborne disease, but because we have the added contact precaution here, we have to do this very slow. So it's a technique that our healthcare providers have to practice. She slowly removes that, because this will flip back on you real quick. Slowly removes that, moving away from her body. She removes her final pair of gloves, and there's a sink in this anterior room. She's going to turn immediately, washing her hands with soap and water, and then she's also going to hand sanitize. So that is a long process that they have to go through. It is a long, slow process, and we're going to make sure we do that every single time we have to go in. Of course, Pam will